Hello and welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County, and today I have with me Lisa Cavanis from Caldwell Hospice and Palliative Care. Welcome, Lisa.
Thank you, Paige.
We are coming up on National Hospice Month, or National Hospice and Palliative Care Month, I should say.
That's right, in November.
So it will be here before we know it. What's going on this year for National Hospice and Palliative Care Month?
Well, National Hospice and Palliative Care Month gives hospices across the nation the opportunity to inform and educate our communities about the personalized individual care that hospice provides. And Caldwell Hospice absolutely wants to share with our community the services that we provide for them.
And this year, you have a tagline, a motto, I don't know exactly what you want to call it, but care you deserve.
Care you deserve is our key message right now. And we've started using that. You'll see it on a lot of our materials, and you'll hear us say it a lot. But more than any of that, we hope you see, we want you to realize that we do it a lot. We want to give you the care you deserve. And part of National Hospice Month gives us the opportunity to educate the community on what that care they deserve is. Because sometimes people don't ask for something because they don't know it's available. And so we want people to know, and the best time to know about hospice and learn about it is before you need it, because at that point you're in shock a little bit sometimes, and if you know the resources available before you need them, when you need them, it's back there. You're ready.
It is back there, and from personal experience, I can tell you that having family members who have been cared for by hospice, that when you hear that word, it's still, there's something in your heart that breaks. Mm-hmm. But to know a little bit and to understand really helps people. So when you talk about care you deserve, what services are encompassed in that?
Well, I think people are surprised when they find out the services Caldwell Hospice provides. We provide care with a holistic approach, which means that we care for the whole person, and that's the physical health, which that's what most people think of. But we also address the physical and emotional needs and spiritual needs of a patient, and those are just as valid as physical needs. And so we have a team that works together. When a patient comes in, we kind of live in a cookie cutter world right now where you don't see a lot of individualized care, especially in health care. And so for over 38 years, Caldwell Hospice has been one of those places that provides individualized care. And we look at each patient and talk with them about what their needs are and what their wants are and their goals. And our team works together to develop a plan of care to meet their specific needs for them as well as their family in that time together. And we have provide doctors and nurse practitioners, registered nurses, certified nursing aides, medical social workers, chaplains, volunteers, just that full circle of care around to provide them the care that they deserve.
And when a patient comes to hospice or considers hospice care, what services are automatic?
Well, automatically, of course, the provider, but your own physician can still follow you as well. They become a part of that team. So the provider and a nurse, and then certified nursing assistants. That's, if you want that or if you don't want that. It just depends on your needs and your wants. We also have medical social workers, the chaplain. That's at your discretion as well. Some people have their own personal pastor, or they don't need that extra service. That's met other ways. So we don't force anything. We just meet you where you are.
And it really is about choosing the services that are right for the patient as well as the family.
Right, and as your needs change, or maybe your needs change, you may at the beginning say, I don't need to talk to a chaplain. I've got a pastor, or I don't need any of that service. And as things progress, you think, I wouldn't mind talking to somebody. It's fine to say, I do want to talk to that chaplain, or I don't need a volunteer right now, but as things progress, you think, that might be helpful. So it's not set in stone at the beginning. You can change as your needs change.
And you also offer some programs for people. I know when we talk to your volunteer coordinator, we talk about some of the specialized volunteer type programs where you may have pet therapy or music therapy for people who that's an interest.
Right. And we have the Legacy Project, which I think is that's really close to my heart. I think that's such a great service. And we have volunteers who are trained to do legacy interviews, and that can be telling about as you grew up, or just messages to your children or family members. And they videotape or film that, and then there's some simple editing, and we create DVDs for the family as a keepsake, and they've got that history and those messages, and we've done that with video, of course, but then we've also done one patient recently. She wanted to write a letter to each of her kids, and I think she had six children.
Wow.
And so her medical social worker worked with her, and she asked her the same questions as prompts for each child, and so I created a little booklet thing that answered those same things about recollections of them as a child and special memories about them. And it was just, I thought how special that would be if that was my mother.
And I think when I think about hospice, I think about the relationships, the nurse, the social worker, anyone that serves a patient starts to develop with that patient and the family. It's not something that's forced. It becomes like a friend visiting.
It does. And I think that's because our staff, they really do care. It's not just another patient to check off their list. We try to provide care to the same level and quality that we would in respect as if it was our own family member. And when you do that, it can't help but become connected, like, it feels like your own family members. So, and we hear that a lot.
I'm just speaking from personal experience. I know that, my family member looked forward to the visit from the nurse and from the social worker. They were a little hesitant at first about the social worker, but then it wasn't long before that was like a friend visiting just to check up on them.
Right.
And it was a very positive experience, and I think people often don't realize how positive hospice can be.
And sometimes if you're dealing with advanced health issues, you're not seeing a lot of different people other than your family, and you love them and you want to spend as much time with them, but sometimes it's just nice to see a fresh face or a friend, somebody different. So, that meets a social need as well.
It does meet a social need, and as we think about where hospice is provided, sometimes people think it's only provided in that big white house at Kirkwood or that big white house down in Hudson, but that's really only just a very small fraction of the care.
It really is. We provide care wherever a patient calls home, whether that's a long-term care facility, their private residence. We've provided in the hospital and in our 2 patient care units. But our average daily census is over 200 a day. And between those 2 patient care units, we have 18 beds. So obviously, most of them are somewhere else. And and most people would rather be at home if that's possible. And so we go to their homes.
And we keep using the term family, but I want to be clear that that's whoever the patient considers their family, right?
Right.
It's doesn't necessarily mean a blood relative. It's whoever that patient trusts and loves. The care you provide, it may take place in the home, but it's provided 24 hours a day, 7 days a week.
Absolutely. We have on-call staff that are available anytime you need them, and we make sure you're taken care of.
So there is a lot into that care you deserve.
Absolutely.
And a lot of different services. But as part of National Hospice Month, let's get back to that.
Okay.
You have a special request.
We do. National Hospice Month is the whole month of November, but for the second week of November, we are asking local businesses, organizations, churches, anybody with a sign to please share our message on your sign for that second week. I think it's the 8th through the 14th. That says Care You Deserve, Caldwell Hospice and Palliative Care. Or Caldwell Hospice if you've got a little sign. I know palliative care is a mouthful. But if you would just share that, that's enough to increase awareness and get people curious and interested so they can find out more.
If people want to find out more about hospice, how can they do that?
They can call us at 828-754-0101 or go to our website at www.caldwellhospice.org, and there's great information there, general information about all the services that we offer, and then there's a section under that shows you can download a copy of all of our brochures, all of our newsletters. You can request to be on our mailing list for our newsletters. There's just a wealth of information there that can get you started and tells you who to contact if you want more information.
And when people are referred to hospice care, how does that happen?
Well, it can happen in a lot of ways because anybody can make a hospice referral. And that doesn't mean that you're automatically admitted if I call up and say, you need to admit so-and-so. But we evaluate you to see if you meet the medical criteria for hospice. We also have a non-hospice palliative care program, and some people who are called in, they think it's a hospice referral. They're really not hospice appropriate, but our palliative medicine services would really benefit them. And so you may not know exactly what you need, but you can call in our admissions team. They'll talk you through it and determine what the best options are, and then give you the choices of what you need. So your doctor can make a referral. You can make a referral yourself for a family member. Your clergy can do that, a friend. Anybody can make a hospice referral. Just even if you're not sure, I don't know if it's even, we're on the realm of being appropriate. Call us and say this is what's going on, and we'll tell you. They can tell you our services really aren't appropriate for you at this point. But maybe here are some resources you can look into, because we're all about connecting people with resources.
So it's a phone call where you're going to get some help, some way. They're going to at least point you in the right direction.
Point you in a direction.
And Lisa, you used the word hospice appropriate. Big picture, what makes someone hospice appropriate?
That's a great question. Medicare sets guidelines as to what is hospice appropriate, and there's the hospice Medicare benefit, which covers hospice care. And that means that you have a medical diagnosis of 6 months or fewer if the disease continues its current course. Of course, nobody knows that, but say if you've got disease A and it continues the way it is right now, there's a chance that in that 6-month window that could be a terminal illness. But many times that, especially with hospice care, you'll improve some, just your quality of life improves. So they reevaluate when it's getting close to that 6 months. And if you still meet that criteria, you're signed up for a second session. And so we can do that as long as you stay appropriate. Sometimes patients improve and are discharged. Sometimes they are discharged completely, or sometimes they think maybe you just need palliative medicine services. And so we just meet them where they are.
So it really is back to the patient, to the individual. And I know we talk every month with someone from hospice, and one of the things that stands out in my mind is always, it's about the earlier you can become involved with hospice,
the more benefit.
The more benefit in that end-of-life journey, because it is a journey.
Right. And some people, when they hear hospice, they think, oh, that's just giving up. But we don't look at it as giving up. We look at it as taking control of your life choices at the end, and making the most of that, whatever quantity there is. We want the best quality.
And it's quality not only for the patient, but for the caregiver, for the family.
Absolutely. It's such a range of support. People don't realize the hospice Medicare benefit covers all your prescription drugs that are related to your terminal diagnosis, so those are covered and you're not paying for those out of pocket anymore. If you need durable medical equipment like hospital beds or wheelchairs or those kind of things, those are covered under the hospice Medicare benefits. So that takes a big financial burden off the families many times.
It really is a stress relief knowing you have that extra support coming in to your home.
Right.
Or to your loved one who may be in a facility.
And a lot of people, I have heard me say that even if I didn't need to call somebody, I didn't need help, knowing that they were there, that I could call if I needed them, just gives a peace of mind.
Yeah.
And I think that would for me too.
As a family member, it does give a peace of mind because you know that you can call 24 hours a day, 7 days a week, and it may just be, you know, my loved one is uncomfortable, and can I give them more pain medicine?
Right. It's good just to know you're not alone.
You're not alone, and you're not guessing.
Right.
Because we don't have medical degrees. We don't have that knowledge, but you have that background of somebody that does.
Right. And they are our clinical staff is so well trained in end-of-life care and to make people comfortable in symptom management. Is such a big deal. Much of our staff is hospice certified. And somebody asked me just today, said, well, what's the difference than just going to your regular doctor? I said, well, it's the same difference as if you had a heart attack and you just went to your primary care doctor. You go to a cardiologist because they have special training in heart issues. We're the specialists in end-of-life. We're care specialists, and we provide that level of care you deserve in a way that we're just trained specially to do that. That's our focus.
And the other thing that I've learned sitting in this chair interviewing your staff is when they come to talk to you, they're not going to talk in huge medical terms. They're going to talk in layman's terms that you can understand.
Right.
So it really is big picture, a care you deserve, and bringing you, I would almost like to say, into the hospice family.
Well, that's very true.
Because they are there to support you and provide you that care. So, Lisa, thank you for what you do, and thank your staff.
Thank you very much. It's a privilege to serve our community.
Is there anything we've forgotten today? We've kind of rambled all over everything, but I do want to remind people, assigns, businesses, churches.
Right, that second week of November, Care You Deserve, Caldwell Hospice.
And civic clubs.
Oh, absolutely.
There's a lot of
your
places.
Facebooks. Maybe you don't have a sign out on the street, but we would love for you to share it on Facebook. And I've got graphics I'd be happy to send to you.
And I'm sure Lisa will be putting up graphics on Hospice's Facebook page because they do have a Facebook page.
We do, and we would love for you to share those.
So be sure to look for those.
Absolutely.
Lisa, thank you for being here and for talking
Paige.
about National Hospice Month and all the services you provide. And thank you for watching Caldwell County Today.